Hello everybody. In today's video, we are going to discuss regarding breast augmentation with silicone implants in Mumbai, India. So, if you are thinking of getting something to be done for your small breast, you want to increase your size, or your breasts are a little bit saggy and you don't want to go ahead with a lifting procedure, then you can think of doing a augmentation with silicone implants. I am Dr. Samir Ahire. I am a board certified cosmetic and plastic surgeon, and I do practice in Mumbai and Goa in India. So let's start with today's video. Breast augmentation with silicone implants is one among the most common cosmetic procedures performed in India. We do good amount of breast augmentation, and many people think that it is a very straightforward procedure. But to remind you, it takes a lot of planning and discussion with your surgeon, and you definitely do come to an outcome in which your patient is happy, and as well as she is satisfied with the results. So for this, the planning has to be meticulous, and your suggestion is what the patient depends. So definitely your surgeon should have that kind of experience to guide you and to help you in the best possible way. So with your surgeon experience, when you are researching regarding breast augmentation, you do good amount of groundwork. But when you actually consult, all your concepts and all your things are pretty much clear, so that you can make that decision. So the first thing is what kind of size you are looking for your breast. So definitely this is the one and the most important factor while going ahead with a breast augmentation with silicone implants, because when you ask your patients, they do tell you, I am this size, my cup size is this is my bra size. But one thing you need to remember is each manufacturer of bra, the size is different, so it's a variable factor. So there has to be a good starting point. So what we do is we actually measure your chest circumference, and we do consider this to be your bra size, which is measured at your inframammary fold. Second thing is we do assess your cup size, what kind of cup size you are having, whether it's A, B, C, D, and depending upon that, we'll suggest you what implants you can think of. The most important point here is to consider your body type. What is your height, what is your weight, what is your shoulder span, how much is your chest circumference. Depending upon that, you select the implants. If you are going to select a very large implant, then you might have sagging in future, you might have skin stretching, or you might have complaints like neck pain, back pain. So all this, to avoid all these things, please do take suggestion of your surgeon and then choose the size. The next comes here is what kind of tissue quality you are having. For example, if you are having B cup size or C cup size, you can go for subfacial implants. If you are having A cup size, you are having very little tissue, then it's always advisable to go for a submuscular pocket during your implant procedure. The second factor is what kind of implant to choose, whether you should go ahead with a saline implant or a silicone implant. In India, if you are less than 21-year-old, we don't put silicone implants. If you want to go ahead, we can use a saline implant, but we never put a silicone implant for patients who are less than 21-year-old. The advantage of saline implant is there is a shorter incision, small scar. If you are having asymmetry, we can correct it by deflating some of the saline or putting more in the other breast. But the disadvantage is if you are going to keep the implants for long period, you might have rippling, you might have capsular contracture. So because of these things, we don't advise you to go ahead with a saline implant. The advantage of silicone implant is it is smooth, it gives more of a breast appearance, it is softer, and the chances of you having the rippling is also very less. When you palpate it through your breast, it appears to be more natural. The third factor is what kind of incision your surgeon is preferring. So usually there are four kinds of incision through which people have put implants. One is inframammary, which is the most common. Second is the transaxial. Third is your periareolar, and the fourth is your transumbilical. Transumbilical requires specialized instruments through which we only put saline implants, because it's a very small tunnel we make and you have to inflate it. So saline implants can only be through transumbilical, only saline implants can be inserted, while rest of the three approaches, yes, To consider, I'll tell you, if you're looking for inframammary approach, this is the most common. We take somewhere around 4 centimeter incision. We can put it subfacially, submuscularly, whatever you want. Second is trans axillary. We take a cut which is hidden, not visible, but the limiting factor here is you have to put the implant below your muscle, because the dissection is a little bit more easier putting it below the muscle rather than putting in the subfacial. So patients who do want a transaxial axillary approach, I tell them specifically ki I'll be putting your implant below the muscle. The third thing is periareolar. Periareolar, usually these days we don't prefer because it actually goes through your breast. So we try to avoid this kind of incision. The fourth is in which pocket we are going to put, whether we are going to put it subglandular, subfacial, submuscular, dual plane. So to beautifully tell you, there are only two approaches which we do prefer, which is submuscular or subfacial. We don't do it subglandular anymore. In advantage of submuscular is the pocket creation is easy. There is an extra protection above your implant. So patients whose tissue quality is not good, we usually prefer submuscular implants. But these days I do prefer putting it subfacially because it gives an excellent shape, good curves, and the results also what we achieve with subfacial is excellent. Plus to that, the recovery is shorter. Patient doesn't have pain to that extent. The recovery is easier, faster. So subfacial is preferred by me more these days. Last and the final factor is whether you are going to need a breast lift. Most of the patients who do come, they are little bit confused regarding whether they are having really concerned about the small size or they want to do something for the sagging or loose breast. Because if you do breast augmentation in a patient who is having sagging or loose breast, you are going to make it more saggy, you are going to complicate it. So if you are having sagging, ptosis, loose breast, you need some kind of lift, because anatomically the position of nipple has to be corrected, which can't be done with breast augmentation with silicone implants. So whenever you go for consultation, keep an open mind. Don't keep that factor that you are not going to do a breast lift surgery because of the scar, because of the cut, but then keep it very clear what kind of results you want. If you are looking for results, then definitely a little bit of scarring element you have to accept. So this was in short regarding breast augmentation with silicone implants. What all things you need to consider, what all things you should know, you should do your research before going ahead for the consultation. So if you are also looking to get a breast augmentation done with silicone implants, come to us, visit us, we'll help you in your journey. And if you have liked this video, subscribe to your channel, because you will get lots of videos related to silicone implants on your channel. Thank you.